Everybody, Al Rochelle here with Tampa Bay Times political editor Adam Smith. We'll introduce our guests.
Thank you. We have Brad Woodhouse, who's leading the Americans United for Change.
That's correct.
Cheerleading for Obamacare, fighting back against the critics like Jim DeMint and company. What are you hearing out there? It's still not very popular in the public.
Well, it's interesting. It really is. If you look at Obamacare just as a static issue, it's a little less popular than it is popular. It's been 50-50 at times, but right now, frankly, it's a little less popular than it is popular. But if you look at what the Republicans, and if you look at what former Senator Jim DeMint, if you look at what Senator Marco Rubio right here in Florida advocate for, which is to repeal it, to just do away with it and go back to the system as it was, that's not popular either. Only about a third of the public wants to repeal it. Most people want to implement it, try it, fix it if necessary.
There's nothing about health care, period,
right,
even before the Affordable Health Care Act was put into place, or as it's being put into place. So what's the biggest misnotion, biggest piece of misinformation you think the public is getting about this?
Well, there's actually a lot, and I think that's what's unfortunate is that it's going to have the effect of discouraging people from learning more because they're getting so much information. But probably the two biggest are, one, that it's hurting the economy, which all available evidence says that that's not true. I mean, we've seen the unemployment rate drop almost 3 percentage points since Obamacare was passed. The other is cost. That it's going to have all these exorbitant costs for businesses and for individuals. And the evidence as it comes in is finding that that's just not true. We've seen in a number of states they're estimating premiums are going to fall, and businesses, especially small businesses, are going to have access to subsidies. So, look, it's going to cost money. But the cost to individuals and to the overall healthcare system, we believe, is going to decline.
Mm-hmm. What do you? Should people be disconcerted or concerned where there are these assorted waivers? They're going to unions. They're going to some companies that they get waivers from some of the elements of Obamacare, particularly taxes.
I don't think so. I mean, look, this is how you want the government to react. If there are situations that need to be fixed that can be addressed through waivers, or some of the delays which may have caused problems. You know, there's a delay on the accounting as it relates to out-of-pocket expenses, and they made that decision because the insurance companies weren't ready. Their computer systems could talk to each other. So,
and a delay on the employer mandate.
And a delay on the employer mandate, and that was at the behest of the employers. So, you know, those things I think they're smart government policies to say, well, it starts on October 1st, just do it and let the consequences be damned. No, make sure you're doing it right. If it delays it a little bit, if that inconveniences a few people to inconvenience fewer, then that's the right thing to do. I don't think people should be concerned. What I think they should do is be educated.
2009, somewhere in 2009, you had all those town hall meetings, Tea Party uprisings. We had some here in Tampa, and it was largely backlash against Obamacare, which is no longer a bad word, I guess, for Democrats. And it resulted in a tidal wave for Republicans. Are you worried that's coming back again?
Well, not really. I mean, there are a couple things. One, and as you know, I was at the DNC at the time, and what we learned after the election was that healthcare only played a partial role, that it really was the economy. I mean, people were thinking about jobs. We were at 10.5% unemployment some months before the 2010 elections. I actually think if you look at what's going on now, this August is a lot different than August of 2009. There's certainly not as much energy on either side out there as there was in 2009, but to the extent that there is, it really is on the progressive side, targeting Republicans on issues like immigration reform, for example. A lot of Republicans have been under intense scrutiny on immigration reform this summer, and others, some that we've been responsible for, have been under scrutiny for their opposition to Obamacare.
Did it help you when Nancy Pelosi said we have to pass this to figure out what's in it first?
Well, I don't think that was. I think that was inartfully said. Obviously. Okay. But look, the principles of healthcare reform had been debated for a number of years. The interesting thing about Heritage Foundation and Jim DeMint and the tour they're doing this month against Obamacare is Heritage sponsored a very similar plan in the 90s in response to the plan that Bill and Hillary Clinton were pursuing when he was in office. So some of this is just politics, and that's unfortunate because there are issues that you can play politics with. Healthcare is one that's a little more dangerous.
So a lot of people think that if the Obama, Mr. Supposedly great communicator, had gone on the offense and sold this from the beginning, instead of letting it be defined largely by critics, the entire climate would be different.
Well, you know, it's interesting. I think I remember in the lead up to the 2010 elections, and maybe right after it, the president actually acknowledged some of those failings, and that was a failing, I think, among all of us. We wanted to educate the public about the benefits, and we didn't want to get caught into the political crossfire, and we probably should have been more aggressive.
Well, Brad, hopefully we can get you back in about a year from now and have this conversation.
Absolutely. I'd love to do it. I think it'll be a whiz-bang success.
All right.